taking the time with me today to really talk about what you're working on with Valera Health.
Thank you.
I'm really inspired by the work you're doing, bringing the technology of telemedicine to mental health, but really doing it in a unique way because it's more comprehensive. And so I wanted you to start by just talking about that. What's the mission and vision at Valera?
Sure, absolutely. So Valera is a virtual mental health clinic, and we have therapists, psychiatrists, and case managers who take a team-based approach to care. And what's really unique is that we do have a comprehensive model where we take diagnoses from the mild and moderate end all the way through serious mental illness like bipolar disorder and schizophrenia, which often you'll see in virtual health and mental health, that those populations aren't served in a virtual model.
Yeah.
So we intentionally, treat and don't turn away the high acuity complex patients.
Compared to an app that we might find here that was more about mild and moderate cases, anxiety,
Exactly.
depression, is sort of a different model.
It is, yes. And we also treat ages 6 and up, so we do treat children and adolescents as well as adults. So it's really comprehensive in that age range and the diagnoses that we treat. And we intentionally work across commercial, Medicare, and Medicaid insurance lines so that even more people have access, and that cost is not a barrier.
A lot of innovative companies have gone direct to consumer, trying to help people, wellness apps. You're working with obviously health systems providers, going that route. How have they responded to this kind of technology in your approach?
I think very well. We partner with over 20 health plans now. And because we do work across all lines of business, we work with commercial, Medicaid, and Medicare plans, the large national plans, as well as regional plans in the different states and markets that we're in. And it's very well received because they don't have partners filling this gap of serious mental illness, and it's one of the highest cost portions of the population and hardest to treat.
Yeah.
So it's really filling a big gap that they're seeing.
In these conversations, it's easy to stay very high level and stay pretty macro, and yet what we're really talking about is, human beings struggling with some of the toughest challenges that you could really imagine. So
Yes.
is there a patient or a patient profile that really comes to mind that inspires you to keep going when it's tough?
Definitely. We've had so many meaningful patient stories that I think keep all of us really motivated and mission driven at our company. There is one that comes to mind. We had a patient who was a woman in her 40s. She had been negatively impacted by the pandemic and that she was laid off from her job in the service industry due to COVID. So she was really going through some hard times, struggling with depression, and had some passive suicidal ideation where she had thoughts of maybe, people would be better off if I wasn't here anymore. And that's kind of where we came in and started working with her. And it's kind of an example of the team-based approach that we have because she had therapy with a licensed therapist who is delivering evidence-based therapy for coping with depression symptoms. She had medication management with our psychiatry team and a case manager who was, coordinating and bringing all her care together, and also referred her to community resources that she needed. So she was linked with Accessoride for transportation and got to appointments that she couldn't get to before. So she really expressed that appreciation that we were treating her holistically, and she got all those services in one place from a team that was, working together. So I think in that case, she started to really improve and is still with us in our program and doing much better.
It's fascinating that all those different pieces are handled on the same dashboard. I assume that's sort of like the technology piece of what you've developed. Obviously, in many ways, you're delivering care that already existed. You didn't reinvent the wheel in terms of those different silos of care, whether it's a ride share or it's a therapy appointment, but to figure out a way to coordinate it. Is that sort of the secret sauce?
Yes, so we have a HIPAA-compliant proprietary platform, the Valera Health platform, and that is what our provider network uses to provide the care and coordinate the care. So we have a care management dashboard for our over 400 providers, and we also have a patient-facing app. So the patients can chat with their care team, see content and educational materials, and do their video sessions right in the app.
Got it. What are you most excited about what you're developing next for Valera?
So what I'm really excited about are some of our new partnerships. We just announced a partnership with Multicare Health System in Washington State. So we're very excited about that and partnering with them to expand access across Washington, including those more vulnerable populations, those who might have Medicaid plans, or live in kind of rural areas where it's hard to find care. 40% of our patients actually live in areas that the government has said are healthcare provider shortage areas. So people who can't normally access care, and we're reaching those populations.
Got it. Just to clarify, you're able to deploy the platform using the providers that are in that network versus, I assume you're not deploying your own provider network in the region.
We are actually.
Do you do both?
Yes.
Or is it one or the other?
We can do both.
Okay.
Yeah, we do both. So we are now in 7 states and growing and expanding with several more states to come. But in those states, we actually recruit our own provider network. And 40% of our providers are full-time employees with us. So we have licensed social workers, MDs, psychiatric nurse practitioners, the case managers and care managers. They all make up our own Valera network, and they practice the Valera model. Which is also very focused on quality and measurement-based outcomes as well.
That's a key strategic decision, and something that's different between different sort of health innovation companies. Some want to be just a pure platform play, as they say, and I'm guessing, and you can correct me, but by keeping it coordinated and in-house, you're able to have sort of quality control over that care coordination.
Exactly. That's so true. When you see these kind of network aggregators that are bringing together private practitioners, those people are all still kind of practicing their own way. It's very hard to measure, but what we do is we bring in Valera providers who practice our care model and have supervision and report up to our clinical leadership. And through that, we're able to really focus on quality measures. We measure things against HEDIS and CQA, like quality standards in the industry, as well as report to our partners on depression outcomes, anxiety outcomes, patient satisfaction. So that's a huge piece of what we do as well.
So the Valera Way, so a piece of that is obviously, to teach providers to work in a team-based way. So that's obviously a piece of it. What's another element to what the Valera Way represents?
Yeah, another element is, we do evidence-based care, so we use a lot of cognitive behavioral therapy in our therapy practice. And then we have a great, clinical leadership team who are, psychiatrists who, come from backgrounds where they've worked in hospitals, they've worked in acute care settings, and they're really dedicated to bringing that into a virtual setting. So everything from managing high risk to, how we prescribe and how they work together as a team, and really making sure that the providers have a resource and a place to go if there's a complex patient. We always have supervisors available, ready to do a conference on that case and make sure we can deliver the best care possible to this patient.
Lauren, thank you for taking the time with me today. I think that in-house coordinated model is really powerful. I've seen that as a trend elsewhere. Versus just this distributed network, a platform where you can really control the quality and create a replicable model that works.
Yes.
So thank you for doing this work and for really bringing care to these populations.
Thank you so much. Thanks for having me.
All right.